afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Mary Bartram, Director of Mental Health and Substance Abuse at the Mental Health Commission of Canada. Please go ahead.
Thank you very much, and thank you, everyone. Welcome to our webinar. We'll be discussing the request for proposals for community-based research in cannabis and mental health. So before we get going, a few housekeeping items. Please note that there is no dial-in number for the English audio for this webinar. The audio is being broadcast through your computer speakers. Please ensure your speakers are turned on and the volume is up, and if you are having issues, please let us know through the chat box. We're pleased to provide simultaneous interpretation and a fully bilingual chat box for this webinar. Please feel free to communicate in either official language. If you would like to view the presentation slides in French, please let us know through the chat box. If you would like to listen to this webinar in French, please use the dial-in details provided on the screen. At any time throughout the webinar, please send in your questions via the chat box in either French or English. We've reserved time at the end of the webinar, but please also pose your questions as we go. Please note that this session will be recorded. If you would like a copy of the recording, please contact us at cannabis@mentalhealthcommission.ca. A slide with our email address will be displayed at the end of this webinar. You can also download copies of the slide deck by downloading the file on the bottom right-hand side of your screen. Okay, so just to introduce myself and the speakers today, my name is Dr. Mary Bartram. I am the Director of Mental Health and Substance Use here at the Mental Health Commission of Canada, and I will be moderating the discussion and the question and answer sessions. We also have Lynette Schick here, who is the Research and Policy Analyst with the Mental Health and Substance Use team at the MHCC. Joanna Oshaka, who is the co-director for the Center for Community-Based Research, along with her fellow co-director, Rich Jansen. Donna Atkinson, who's the manager of the National Collaborating Center for Indigenous Health, as well as Roberta Stout, the research associate for that center. But we're very pleased to have everyone here with us today. So just to provide a quick overview of the agenda, the presentation will take approximately 30 minutes, so we should have about an hour for Q&A with speakers and people who are participating in the webinar who are interested in applying for these research opportunities. So first we'll provide a bit of background about the project as a whole, go through the principles for the research applications, provide a bit of information about support that's available through community-based research hubs. We'll turn it over to our guests to go through some of the what's and how's about community-based research, as well as methodologies and considerations for Indigenous research. Then we'll turn into the Q&A and the conclusion. So just briefly, an introduction about the Mental Health Commission of Canada. The MHCC was created in 2007 with the mandate to create Canada's first mental health strategy, reduce stigma about mental health issues, and also mobilize knowledge regarding mental health and mental illness. In Budget 2018, the Mental Health Commission received funds to investigate the impact of legalization and regulation of cannabis on the mental health of people living in Canada. so impacts both in terms of benefits and harms. The Mental Health Commission, in response, created a team to oversee this work. So Lynette and I are joined by other members of our team to support this initiative. And our objectives are to inform and invest in research in cannabis and mental health, centered in lived and living experience, and with a view to sharing and mobilizing knowledge. There are three core planks to the research investments. The first two are academic streams. One are Catalyst grants and team-based grants that we have been promoting and working to develop in partnership with the Canadian Institute for Health Research, some of which are underway. And then thirdly, the community-based research projects. The MHCC will contribute to building the evidence base through basic translational, clinical, and applied research grants, through short and long-term investments in catalyst sufficient to have a project that focuses on cannabis alone or mental health alone, but the connection between the two. So we've just provided some examples for your consideration. For example, you might have a project that is looking at mental health factors that influence why people use cannabis, cultural practices and beliefs around cannabis and mental health, or for example, mental health impacts of criminalization for people who use or sell cannabis or other drugs. In terms of who's eligible to apply, you certainly do not need to be an experienced researcher to apply for this grant. And in fact, we really are hoping that this will be an opportunity for folks who are new to research, new to community-based research, and of course would be community-led. In terms of composition, applicants could include peer-driven advocacy organizations or coalitions. They could be community-based organizations serving particular communities or addressing mental health and wellness or substance use. They might be academic researchers working in collaboration with a peer-driven organization or community-based organization. Or as mentioned, they could be an emerging researcher, a graduate student, for example, or a non-academic practitioner. We would also like to note that we're currently in the process of assembling a review committee, which would, of course, then evaluate the proposals that we've received. And we're working to ensure, with consultation from folks who assemble review committees often, that we have appropriate expertise and lived experience on that committee. What I also just want to take a moment to note that, and this is quite important, that people with lived and living experience and other members of the community, for example, elders, must be represented in meaningful roles. They must comprise at least half of the core team positions in your application. And certainly because we are hoping to encourage first-time researchers in this opportunity, and we recognize people may need some support in developing their application, we do have supports in place to help you develop your application. So you could reach out to us, and I'll give you some more information here shortly on how to do so. In terms of helping bolster capacity of potential applicants, we've partnered with experienced community-based research hubs from around the country who can offer guidance to you free of charge. These community-based research hubs are the Center for Community-Based Research, the Center for Healthy Communities, Inuit Tapiriq Kanatami, that's specifically for Inuit applicants, the National Collaborating Center for the Determinants of Health, the National Collaborating Center for Indigenous Health, and the Wellesley Institute. So these hubs will be available to connect with you to discuss your application, to provide feedback and guidance before you submit your application, and potentially they could even link you with other members of a team if you're looking to assemble a team. And so we would encourage you to reach out sooner rather than later if you are interested in working with a hub to develop your proposal. If you're interested, we ask that you not reach out to the hub directly, but rather contact us at the MHCC by emailing cannabis@mentalhealthcommission.ca, and we'll link you up with the appropriate hub. The deadline to request support to be connected to a hub is March 30th. I'm now pleased to introduce our first speakers from one of our community-based research hubs. The speakers will be Joanna Ohotska and Rich Jensen from the Center for Community-Based Research.
Thank you very much, Lynette, and hello everyone. Good morning, good afternoon, Canada. We know that people are coming from across the country. We prepared a short 10-minute presentation to clarify a little bit further the community-based research approach, but we would like to start by telling you a few words about our center that you can see us in the context of this organization.
Next slide. So the Center for Community-Based Research, we've been around since 1982. We're a nonprofit organization that we're located right now on the University of Waterloo campus. We try to do research with people, not on people. And over the years, we've done about 400 projects. Our story began as a reaction to academic research, but today we find ourselves on the university campus as more and more people are doing community-engaged research. We have no core funding, we're entrepreneurial, and we're entirely contract-based. Next slide.
We organized this short presentation by clarifying a little bit more what is community-based research approach, how to conduct community-based research in few words, and also how to get help with ethics process. Next slide.
For those of you who like definitions, here's a definition that we like and often use. That community-based research is an approach that involves active participation of stakeholders, stakeholders being those whose lives are affected by the issue being studied, involving them in all phases of research for the purpose of producing useful results to make positive changes. So now we'll kind of unpack this definition and see what it actually means in life. Next slide.
So the essentials of community-based research. We like to talk about community-based research as a distinctive form of any other research. And we like to say that there is a small code to remember, and when we apply this code, it is much easier to see the distinctiveness of the community-based research from other conventional research. So we would like somebody to tap, because there will be the code coming right now on this slide. 33411, this is the code, and we will unpack this code to talk about what it means to do community-based research.
Next slide. So what makes research distinctively community-based? Well, one way to think of that is what are the hallmarks or what are the principles that undergird this approach to research? And from this slide, we can see that it's a research approach that strives to be three different things. Firstly, community-driven, that the research is relevant, it's practical to those most affected by the issue under study and leads to their self-determination. This hallmark connects with the Indigenous research tradition in which research should lead to self-determination. Research is also, community-based research is also participatory. It asks the question, who has a stake in this issue, and how can we meaningfully involve people throughout the research process so that community members and researchers equitably share control of the research agenda through their active participation and reciprocal involvement. And that involvement is across the process of research from design to implementation and dissemination and acting on the findings. And this hallmark connects to the Southern research tradition in which people are brought together to understand their context and make change. Which leads to the third hallmark, which is action-oriented. And here the emphasis is on change, on that the process and the results are useful to community members in making positive social change and in contributing to communities where everyone is supported and belongs. And this hallmark connects to the Northern research tradition in which change is a desired outcome of research. Next slide.
So this is a second number 3. And another way to understand community-based research. This slide shows us what functions community-based research performs. And there is 3 functions of community-based research. One is about knowledge production. So as any other research, through very systematic and rigorous research process, community-based research produces knowledge. Community-based research is not satisfied only with this one function. Also, Another function is to mobilize this knowledge. So helping people to know about research results, but also how the results can be used. So sharing results and communicating results to others. This is not enough, and pushing us for the third function of community-based research, which is about mobilizing people. So mobilizing communities by facilitating relationship building and engagement and further future actions. Next slide.
So that's a bit of the theory of community-based research, the first three, the hallmarks and the functions or goals. The next two numbers are about how we do it, the practical, how we actually implement a community-based research project. And here there's 4 phases, and if you add up all the little dots on this chart, you'll see that there's 11 steps which are nonlinear that constitute a community-based research project. So the 4 phases, there are laying the foundation, research planning, information gathering analysis, and acting on the findings. In all research, we emphasize phase 2 and 3, research planning and information and gathering. Community-based researchers add 2 more phases up front, the laying the foundation phase, as well as phase 4, acting on findings. You'll notice if you look at the smaller writing on that page that there are both relational as well as technical aspects to each of these 4 phases. And each phase can be seen as a negotiation or as a discussion amongst the different stakeholders within your project and the different types of negotiation relative to each of the 4 phases of research. When we look at phase 1, we emphasize that phase because this is really where the negotiation about roles and goals of the research happens. You can see the different technical steps leading to identifying the purpose of the research and a purpose that is agreed upon by all people that were involved in the research. And going over to acting on the findings, again, as Joanna mentioned, the functions of the research isn't just about learning and sharing, it's also about doing something and mobilizing people, and so there's a phase dedicated to sharing learnings and initiating new action that comes out of the research. Another piece to note on this chart is that feedback loop between phase 2 and phase 3, that in community-based research, there may be some changes made to the original research planning based on what you're learning as you're doing your research, and that's okay. That's a part of strengthening your research, your plan, and in order to get better data and better mobilized people. Another point to point out on this chart is the arrow going from phase 4 to phase 1, from acting on the findings to laying the foundations, that there is an arrow there that suggests that community-based research can be seen as cycles. That can be continuous cycles or could be just a one cycle, so that each research project has its own purpose and involves its own people throughout the research, and that you can understand community-based research in which that you don't have to do everything in one research project, but you can build on research projects over time. Next slide.
Ethics are very important in community-based research, and ethics means do not harm to both individuals involved in research processes, but also do not harm communities involved in research. So research needs to be done in the right way and in the way that people are informed and understand the purpose of the research, that they have informed consent to provide information, and people need to agree for their participation, so they are completely aware of our research activities. Throughout the research process, we need to also think about protecting people involved, especially when working with vulnerable populations. Be aware who is using and how the data is being used, recognize power dynamics, problematic relationships, and different motivations. So this all ethics issues are very important at each of 4 phases and 11 steps when we are doing community-based research. Next slide, please.
So again, practically, you can think about different mechanisms to make sure that you are ethical in your research. We'll talk about the external ethical review of community-based research in a moment, but you can also think of your steering committee that's guiding your research project as also having a function of making sure that no harm is being done through each phase of the research. And wherever possible, hiring and training people with lived experience, community researchers, that when as you involve them, that they're also aware of ethical issues and can contribute their lived experience to understanding if harm is being done. On the right, you can see that first point expanded about doing external ethics review, and just want to alert you that there is an organization that CCBR we have created. It's its own nonprofit organization now called the Community Research Ethics Office. It's entirely volunteer-driven that does ethical reviews for community-based research projects across Canada. Its board is made up of people who are in academic settings as well as in a variety of different community settings. They follow the Tri-Council, the academic research 3 core principles of respect for persons, concern for welfare, and concern for justice, but they also add a respect for community, an additional principle to the traditional academic ethical considerations. You see the website there. You just need to click on there, and it's fairly user-friendly to be able to do ethical reviews, formal ethical reviews up front, or to provide, they also provide ethical advice throughout a research project.
Just to add to that, that a Community Research Ethics Office has some agreements or develops agreements with academic institutions. So when you partner with academic institutions, they also could go through the ethics review using Community Research Ethics Office in Waterloo. This concludes our very brief presentation. Thank you very much for your attention, and we welcome questions and any points that you would like to raise during this webinar. So thank you.
Thank you very much, Joanna and Rich, for providing us with that great overview of the principles of community-based research. I'd like to introduce our next speakers from another one of the community-based hubs who will be available to support applicants, Donna Atkinson and Roberta Stout from the National Collaborating Center for Indigenous Health.
Good morning, everyone. This is Donna Atkinson. I'm the manager at the NCCIH. For those of you who don't know us, our center is located at the University of Northern British Columbia in Prince George, BC, and we're on the traditional territory of the Lheidli First Nation. I am joined today by my colleague, Roberta Stout. She is a research associate with the center, and she's based on Treaty 1 territory in Winnipeg. Just for some context, the NCCIH is one of 6 national collaborating centers for public health that was established in 2005 with funding from the Public Health Agency of Canada. We have sister NCCs across the country that are focused on specific topic areas, including infectious diseases, environmental health, healthy public policy, methods and tools for knowledge translation, and the NCC for Determinants of Health, which is also another community-based hub as part of this project. Our center is unique among the NCC program in that we are focused on the health of a population. Our mandate is to strengthen public health systems and support health equity for First Nations, Inuit, and Métis people in Canada through knowledge, synthesis, translation, and exchange. So I should note that we are not mandated for primary research. We are exclusively focused on knowledge translation and knowledge mobilization. So specifically, we promote and support the use of Indigenous-informed evidence and knowledges in public health programs in practice and policy making at all levels of the public health system. We do this in 3 ways: by translating new and existing research and Indigenous knowledges into useful and accessible formats, by identifying knowledge gaps to encourage research in public health priority areas, and through network development to facilitate knowledge exchange and mobilization across the public health system. We have 4 main areas of focus that we work in at the NCCIH. That is social determinants of Indigenous health, child, youth, and family health, emerging priorities in Indigenous public health, and Indigenous knowledges and knowledge translation. And I will post a link to some of our resources in the chat function so you can see what kinds of products we develop and what kind of resources that we have. And just to note that we've recently been renewed by the Public Health Agency of Canada for an additional 8 years, which will take our center and the other collaborating centers up until 2028. So with that, I'm just going to hand it over to my colleague, Roberta Stout, and she's going to talk to you a little bit about the community-based research focus for any Indigenous health projects that should come as part of this project.
So good afternoon or good morning, everybody. I'm really pleased to be presenting on behalf of the Collaborating Center. As Donna said, I'm a research associate with the Collaborating Center, but I'm also here as a Cree researcher who has been involved in multiple community-based research projects for the past 2 decades, which have been primarily focused on qualitative gender-based analysis, participatory and/or arts-based projects. And while it's not possible to touch upon everything that that I would like to in the next 5 minutes, what I would like to share with you is some of the practical and practice considerations that are important when doing research with Indigenous communities and peoples. And what I've learned over my career is that if I'm not comfortable with the research design, the research methods, or the research questions, I can be sure that those who participate in the project will not be comfortable either. So to begin, research is grounded, research that is grounded in sound ethics and respectful relationships begets good research. So while this might sound simple, it really is not, as there is a long history of mistrust between Indigenous communities and the research community, particularly when researchers are not from the respected community. And you can read more about this in the preamble of Chapter 9 of the Tri-Council Policy Statement on Research Involving First Nations, Inuit, and Métis peoples in Canada. So being a researcher means that you are in a privileged position, a position of power, a position of taking and using quote-unquote evidence offered up by your quote-unquote subjects in order for you to make a claim of being an expert. But I believe there is a way that we can do research, the way that I would present research, where these power dynamics can be countered, and a way of doing research that is culturally safe. In other words, as Wilson and Neville state, ideally researchers should employ a power with rather than a power over approach. So researchers carry a great responsibility in the design, the conducting, and the dissemination of projects, community-based research projects with Indigenous communities and peoples. And some considerations that we can recommend you think about while you're starting to design your proposals or put into action your research is understanding that your research project should be foregrounded by sound ethics, and I think that the previous presenters talked a little bit about that, as well as OCAP, and is conducted in a way that is culturally safe for participants. So it goes without saying that good research involves a personal commitment of time for respect for relationship building and trust, and that should be built within your proposals. Also ensuring that the people or communities who participate in research understand their roles and rights within the research project So allow time for questions, let them know that they can choose not to participate or withdraw at any point, or that they can be named or remain anonymous upon their request. So these are some considerations within ethics. Also, be respectful. Carrying out the research means being careful with the emotions and needs of participants without judgment. Have resources available to them if they need them. Don't leave them in a state that they're triggered or re-traumatized through the research project. Participants are not simply subjects who will help the researcher to have their work published or advance their career. So people and communities who are involved in research projects are a part of the process. They should be empowered through the process and should benefit from having gone through the research project. And this can mean that they get the resources back, they get a say in how their words are used or not used, as the case may be. They get voluntary time back from the researcher, or they participate in knowledge translation, etc. Also, be respectful when representing the words and stories. So being true and accurate with what was shared with you, and understand that you don't own the data. Understanding that you are the facilitator for sharing the information. You are not the expert. It's the women or the men or the communities who are the experts and need to be acknowledged as such. In terms of knowledge translation, it's critical to think through how the research findings will be shared. In what format will you present these back out into the communities? What makes the most sense for the community that you worked with? Will the community members be involved in the dissemination of the research results, such as through presentations? So as a researcher, community-based researcher, you need to be flexible. You can't assume that people who are part of your research project are going to be available when you are. You need to make yourself available to them and their schedules, and they should be properly compensated for their time and expertise. And this could include providing honoraria, paying for transportation or childcare in order to participate. And finally, questions and methods can change, and you need to be ready for that within community-based projects. I believe it's a great honor when we hear the stories that are shared with us as researchers, and we need to honor those stories and how they're shared publicly. There are also great possibilities and opportunities when you do good research with Indigenous peoples. And for Indigenous researchers in particular, doing research can be meaningful to one's nation, one's community, and Indigenous peoples generally. Research has the possibility to educate the wider Canadian or even the international community. And it can disrupt colonial narratives or change programs and policies to improve the lives of Indigenous peoples. Also, good research has the possibility of germinating more good research or even reconciliation. So there's many ways to do good research, and there are many ways to disseminate this research, and the CMHA has provided a number of important links in their call out for proposals, and I would suggest you become knowledgeable on these prior to undertaking your proposals and research design. In particular, I would highlight Chapter 9 of the Tri-Council Policy Statement on Research Involving First Nations, Inuit, and Métis Peoples of Canada, First Nations Principles of OCAP, the National Inuit Strategy on Research, and Understanding Free, Prior, and Informed Consent. So finally, I want to draw your attention to a podcast that the National Collaborating Center for Indigenous Health has done, where you'll hear from eminent Indigenous scholars Dr. Linda Tuhui-Smith and Bonnie Healy. This podcast is entitled Indigenous Research Fireside Chat, a conversation on governance and Indigenous research. And in that podcast, you'll hear about more specific ideas around Indigenous methodologies, Indigenous self-determined research and knowledge creation, and aspects around accountability. So for those of you who do not know Linda Tuhui-Smith, she's a Maori scholar who has written a groundbreaking book entitled Decolonizing Methodologies, Research, and Indigenous Peoples. And Bonnie Healy is of the Blackfoot Confederacy and was helped to co-write Chapter 9 of the research involving in First Nations, Inuit, and Métis peoples in Canada. So thank you very much, and we will turn this back to the organizers.
Thank you so much, Donna and Roberta, for joining us and for providing us with some perspectives and important advice and key resources as well to consider for proposal development with First Nations, Inuit, and Métis communities. So thank you very much. We'll be moving now into the question and answer portion of the webinar. We have until about 2:30 to go through your questions. So if you haven't already, please submit questions through the chat box. So the first question we'll start with, is there a rubric for the criteria for the adjudication and assessment of proposals? I can direct people's attention to page 10 of the RFP, and I'll ask Lynette just to speak at a high level to some of the criteria that are outlined there and to the process. So for sure, thank you so much. So certainly you'll see the expectations laid out on page 10, but of course, as mentioned in our presentation, we'll want to see that your proposal relates back to our priority research areas. Of course, it would have to underscore the relationship between cannabis and mental health. That would very much be a must. You would need to outline your proposed research methods and certainly make it clear how these methods are meeting the needs of communities. We would need to see that the research is coming from community, that there's a need for it. And then you would be demonstrating through support letters and so forth that the research project is supported by the community in which you plan to work. And there's more detailed criteria. It's outlined on page 10, but if you have further questions, you can always email us. I would just add as well, Lynette spoke earlier about the composition of the review committee, and certainly our intention is to ensure to the greatest extent possible that we have diverse perspectives on the committee that are representative of the priority populations that are being targeted for this research opportunity. Do either Joanna, Rich, or Donna, or Roberta, do you have anything else to add in answer to this question about the evaluation of the proposals?
No, we don't.
No, nothing from us, thanks. Okay, great. So the next question is registration necessary? I can answer this one. So the short answer is no. If we receive proposals at the deadline that we haven't heard from you before, they will be fully legitimate with us in the sense that we don't need you to have registered. However, if you have any questions, require any support, or most importantly, if you would like to be connected with a community research hub to assist you in the development of your proposal, please contact us through the email address that was provided. The next question, is it okay if the community is a for-profit organization such as a clinic or dispensary? Lynette, can you start with that and I can add in?
Sure. I think that this question might require further thinking through among our team, and so I would encourage you to reach out if you don't feel like your question is sufficiently answered. But I would say that
a for-profit organization wouldn't be considered a community in this sense. So as we're sort of imagining community, you know, sort of three ways to think about community. A group of folks with a shared geographic location, a group of folks with a shared identity, or a group of folks with sort of a shared activity. So in that sense, I mean, maybe you could fit into the third, but really, I would have to say no. But if you want to make this case, please do email.
Joanna or Rich, would you have anything to add on that at this time?
Sure. I think that if the for-profit clinic is a partner on the research project, this is fine. I think there are different partners and different people, stakeholders, we call them, right? Different groups of people involved in community-based research. This is better even to have very different perspectives involved on the project. But primary community needs to be identified. So the research being done by partners with community needs to profit the community, needs to target the community and be welcomed by this community.
Thank you very much, Joanna. Donna or Roberta, did you have any perspectives to share on this question?
I agree with Joanna, as long as the community has a good relationship with that organization and that things benefit the community at the end of the day.
Excellent. Thank you very much. The next question, I was wondering if someone with no experience can participate in this research. Who do I approach for the same? So as Lynette mentioned in her presentation, we are certainly hoping that this research opportunity will be available and open to those who have no prior research experience. If you also are looking for how to connect with a team, then we would encourage you to contact us. I know we had one person so far reach out who was interested but didn't, needed some advice on how to connect with like-minded people, and where we can, we'll try to facilitate those connections. Lynette, did you have anything to add there?
Yep. No, I would just say, as Mary said, we have had some people reaching out already, some individual people with lived experience reaching out, looking to connect with researchers. We've also had a researcher looking out to connect with community. And so we're happy to facilitate those connections, and we'll also pass you, facilitate a connection between you and the hubs, because that's some of the work that they can also support with, is building those research networks if needed.
Okay, great. Does anyone else have anything to add there?
Maybe just, it's Rich here, just to add that this is very common in community-based research to have people who don't have previous research experience to be involved in the research. Many of our projects have that involved, so this is part of the capacity building within communities, is also the skill of how to work together to understand new things and to create new actions through research.
Okay, super. Thanks very much. Next question, is this available to all provinces and territories? Short answer is yes. This is a grant that's available to teams and applicants from across the country. So we would encourage proposals from coast to coast to coast. I don't know if there's anything anybody can add there. Okay. Can this research be used for ongoing funded research? So I'm going to ask Lynette to start there and then see if others have anything to add afterwards.
Yeah, thank you. Great question. I would suggest that because the RFP and this opportunity is really designed with the spirit to invite new researchers to the table, people with lived and living experience and other community members that we would want to, really create new space for folks, and in that way, ongoing funded research, wouldn't be the priority.
Does anyone have anything to add there? Okay, thanks very much. Next question, can Indigenous governments hold the grants? I'll ask Donna and Roberta to start an answer there, and I can contribute as well if need be.
Yeah, I'm sorry, I don't have the call for proposals in front of me, so I think that question is specific to your call to proposals, is it not?
Yeah. Okay, we'll take a first iteration. I believe that would be eligible as long as it meets the criteria of the request for proposals. In terms of who can hold the grants, maybe this would be a good time for Lynette to speak to that again in terms of what kinds of organizations can actually be the recipients and holders of the grant funding.
Yeah, thank you. So as laid out in the RFP, we talk about types of applicants, potential applicants. So on page 4, you'll see peer-driven advocacy organizations or coalitions. We have community-based organizations, so nonprofits that would serve particular communities, so First Nations, Inuit, Métis, newcomers to LGBTQ, and also organizations with a mandate to look at mental health and wellness or substance use. We also have academic researchers working in meaningful collaboration alongside peer-driven or community-based organizations. And so I certainly see nothing here that would preclude the National Inuit organizations from applying. Yeah, we would welcome that opportunity very much so, yeah.
And specifically in terms of Indigenous governments, absolutely, I don't see a reason why Indigenous governments wouldn't be eligible to be the holders of the grant funding. Where we do have eligibility issues would be for an individual to be the recipient of the grant. And so if there was some situation where there was a team where you didn't have an organizational home or affiliation, whether it's with an Indigenous government or an academic institution or some other organization, then please contact us and we'll see if we can problem solve with you. But by and large, as long as there's an organization of some sort that we can enter into a funding agreement with, we can have a diverse range of eligible recipients. Where it becomes problematic potentially is if it were an individual. Does anyone else have anything to add there? Okay, thank you. Our setting is wondering, this is the next question, our setting is wondering whether there are restrictions on how the money can be spent. For example, is the purchase of cannabis excluded? Lynette, can you help us with that question? Is that something that's spelled out in the RFP?
No, that's not spelled out in the RFP, and admittedly, I think I would need some time to think through that. My understanding is research of that sort would need particular research licenses through Health Canada, and so we could connect with Health Canada about how to expedite that. But I think that requires some work thinking through, so please do send a follow-up email, and I could get you a more clear-cut answer.
Does anyone have anything to add there? Okay, thank you very much. The next question, how does this grant fit or not fit in with the CIHR Catalyst grant, cannabis and mental health? I'll ask Lynette to start with this one.
Yeah, great question. I certainly think that we are viewing them as complementary opportunities. CIHR has different criteria for the application, for the composition of their research teams, for sort of qualifications, and certainly not entirely, but CIHR Catalyst grants tend to be most sought by academic affiliated applicants. And so we see the, and I should say they're not necessarily community-based research. So often you're getting quantitative research methodologies, things like this. And this opportunity is specifically community-based research, so community-driven, and then importantly, first-time researchers, non-academic affiliated researchers. So we're imagining that this is an opportunity that's maybe creating new space for folks who wouldn't necessarily be applying to CIHR.
Thanks very much, Lynette. Does anyone else have anything to add on the answer to that question? I'm going to ask the team who's supporting the webinar to send out the link for the Catalyst grant. I recognize that it's a bit confusing because the call for that research is out at the same time. So it would be good to get that link up in the chat box for participants so that if they're interested in comparing and contrasting the two funding streams, they have that information. Okay, the next question, is it considered valid? Is an internal ethics review from inside the community considered valid instead of an external ethics board? So I'm going to ask both centers that are on the line with us to help us in answering this question. So I'll start with Joanna and Rich.
This is a good question, and everything is very context-oriented and depends who are the partners, who are the community, and who are people working on the research project. I think the decision needs to be made there. A community research ethics office will be helpful as a place to go. Academics, they need to go through the ethics reviews. Is it enough? Do you want to have additional community-based review? I think this depends on the context of the research project.
Thanks very much. Donna, Roberta, would you have anything to add there?
No, I agree. It's completely context specific. So you really need to see the bigger picture before you could decide what process was necessary.
Okay, so again, I think where people have questions, please reach out to us, and we can have a dialogue about this in the proposal development phase as well, and connect you with an appropriate hub if necessary. Okay, great, thank you. So can the researchers have backgrounds that are not in mental health, even though they have lived experience in healing depression with cannabis? Absolutely, we're interested in a broad range of lived experience. Certainly, as Lynette mentioned, we are looking for projects that address the relationship between cannabis and mental health, but there's no particular definition or criteria for the types of experiences that people can bring to these research projects. So what you described in the question are absolutely exactly what the kinds of experiences that we're looking for. Would you have anything to add? Would anyone have anything to add in terms of our centers on the line?
I would maybe just say, for example, you might be a First Nations researcher who typically works in Indigenous health and wellness, not necessarily in the cannabis space, but you're working with the community, potentially your community, and you want to put forward a proposal, and certainly that would be fitting. So folks don't need to have any particular, research CV related to cannabis or mental health to qualify for this opportunity.
Thank you, Lynette. Our next question, does an academic researcher obtain research ethics from their institution and the Community Research Ethics Board mentioned earlier? I'll start out with an answer and then ask people to weigh in as well, but my understanding would be that, again, it's context specific. There's the Community Research Ethics Board mentioned earlier, it's not a requirement to use that board. It's only if you don't have access to an appropriate board based on the context of your specific proposal. So certainly as an academic researcher, if you're involved in a proposal, you will probably need to have ethics approval from your institution, but you may also need to consider if there's another ethics board that you need to engage, but it wouldn't have to be the Community Research Ethics Board that was mentioned earlier. Does that sound right to the hubs on the line?
Just to add to that, depends on the board, right? Academic boards. Some academic boards are very traditional boards, so not necessarily they will make suggestions related to making communities first and making sure the processes are very done in the ways to respect also community level of ethics. So just to consider what it needs to be useful, it needs to be constructive, and this is not only a checkbox, right, but also a review that will be helpful to the group which is guiding the research study.
Thank you very much, Joanna. Does anyone else, Donna or Roberta or Rich, do you have anything to add?
No, I agree, though. It very much depends on your university or academic institution. They all have very different protocols, but there is also the overarching Tri-Council guidelines and CAHR guidelines that people need to refer to as well.
Richard, I'll just maybe add that we've had some academic partners who have chosen to go through CREO, the Community Research Ethics Office, instead of their university research ethics board, but they had to make an agreement between their research ethics board, have an MOU with CREO in order for that to happen. So that's an option as well for if an academic, for whatever reason, doesn't feel that there is going to be that community level lens on the ethics review, that there's always the potential to make MOUs with CREO.
Okay, thanks very much. We'll just take a moment to gather our next question. Okay, thanks very much. So I'll just run through a few questions. Are partnerships with municipalities and local public health units acceptable? Yes, again, short answer, as long as the partnerships are approved by the community population, which is directing the research. Partnerships with municipalities or local health units are very acceptable and make a lot of sense from a community perspective. Next question, is it necessary to include a faculty member? No, is the answer. Research teams do not need to be affiliated with an academic institution. While having an experienced community-based academic researcher on your team to help support the work may be very helpful, it is not a requirement to be affiliated with an academic institution. And again, because we're trying to promote and build research capacity in at the community level. That is very open to non-academic approaches, although of course academics are very welcome to participate as well. So next question, is there a declaration regarding conflict of interest? My first thought, I don't think it's written in the RFP, but I do think this is something that would be addressed through ethics, the ethics process that is attached to the project and context specific to the project. But I'll put it out to the community-based research hubs for help in answering that question. So the question was, do proposals need to specify any and declare any conflict of interest? I recognize that this is an RFP question. It's not in the RFP, so looking to see if there's any advice now in terms of how people may want to approach that, and if not, then it's something that people can follow up with us about via email. Okay, so I suggest that people take that question up with us via email, and we may also consider what we can do to post maybe like an FAQ document, a frequently asked question document on our website to promote wider circulation of some of these answers so that we can get them out to a wider range of people. Okay, does an academic researcher obtain, we've already answered that one. Okay, so next question, can international students participate in this project? Yes, absolutely. International students may be project team members, but the RFP is clear about the research needing to be carried out in Canada. Is it possible to have a joint project, 2 separate grants working on a project, is another question coming up here. Sorry, just pausing for a moment here. I think a joint project is something that could be considered. I mean, we want to try to keep this simple, but also be responsive to best thinking and ideas from the community level. Again, I think that might be something that would be worth reaching out to us directly to discuss. Okay, next question. Would a CBO representing stakeholders, so community-based organization representing stakeholders, be able to be the grant money handlers for this grant? I believe so. That if it's not an individual, but there's an organization that we can transfer funds to, that would be eligible. Next question, what would be the reporting mechanism? Is it quarterly or year-end report? Lynette, could you assist in answering that question?
It's yearly reporting as we have it laid out, but as we work with the successful teams to put in place a research contract, we could certainly discuss reporting deadlines that work for both parties.
Thanks very much. Is institutional ethics required from my university and external ethics from the agency you noted in the slideshow? I believe I've answered that question already. In terms of the team composition, if the target is informing care providers and therefore the participants are mental health care providers, would individuals with lived experience be several of the healthcare providers from the target communities? I think this question is, can a community of service providers be considered a community? And I think it goes back to looking at the priority populations for the grant. If there's a case to be made for linking the community of service providers as members of that listed priority populations, then potentially yes, but it would be also potentially a bit of a stretch. I don't know if people have anything to add there on the line from our research hubs. Lynette, would you have anything to add there in terms of whether a community of service providers could potentially meet the criteria for the proposal?
Yeah, I mean, nothing to add, besides what Mary's already said. I think that the service providers would have to also, occupy other categories, be themselves, two-spirit, lesbian, gay, bisexual, queer, for example, service providers who are also, newcomers, something like that, but providers in and of themselves are not among the target population.
So the next question I think may assist with that as well. So the question is, can you please elaborate on the comment made at the start that half of the application needs to involve elders, and I believe it was elders and people with lived and living experience. Did I hear that correctly? Lynette, do you want to elaborate a little bit on that again?
Yeah, for sure. So the comment was that at least half of your team, that people with lived and living experience of cannabis use, mental health problems or illnesses, as well as other members of the community, including elders, must be in meaningful roles in your team, meaningful core roles, and it be in at least half of the core positions on your team. So, for example, if you have a team of 6, at least 3 people would have to be people with lived and living experience and or other community members. And certainly we recognize that, academics are also people with lived and living experience in many cases. They're also members of the community, so we would just want you to make that connection clear.
Thank you, Lynette. In terms of the community, is there a suggested minimum number of people required to participate in the research? I'd ask Joanna and Rich to speak to this question from your experience working with community-based research teams. Is there any guidance you can give to people in the size of the team that would be, what's the range that is been found to be most effective? And then from there we'll see if Donna and Roberta have anything to add.
So this question can be answered from two different points, right? One is the structure of the project team. So structure of the project team will require a research team and will require a stakeholder steering committee. So this is the numbers that could be helpful, like steering committee is a larger group, but also a small group of 7 people, 8, I don't know, more than 10 will be probably too big. So you would like to have different stakeholders' perspectives or people who will be coming from different stakeholders groups to be working together to guide the research study. Research team, this is a smaller number of people who will do the research and gather data and analyze this data and report on all these processes and work collaboratively with the steering committee to plan it and to implement it. But The gathering of data, this is the second aspect, will be happening with people who are having life experience, or people who have a service provider's perspective, or people who have more policy level perspectives. So you can do a lot of data gathering with larger numbers, depends on the method, right? If you use the survey, or if you use interviews or focus groups. So it will be the scope of the study of research participants that will be much larger than the number of people involved hands-on in terms of driving and implementing a research project.
Thank you very much, Joanna. Donna or Roberta, do you have anything to add on this in terms of size of team members, or sorry, size of teams and of the, you know, both the kind of research team and then the broader community involved in the research?
I think that it just depends on the project question and the methods that you're using, and that you just need to keep continue to ask yourself and members of your team and the community who needs to be involved.
Okay, thank you very much. So the next question, I'm a first-timer, just wondering if we can have more guidance on how much to compensate the participants and members of the research team. So I'll ask Lynette to start off in the answer for that question.
Sure, thank you. Yeah, great question. It's an important one. It's a little bit difficult, you know, to say exactly how much you should be paying people. I think, you know, a fair living wage is always appropriate. It's certainly, you know, what we're trying to get at is that there wouldn't be discrepancies among the people on your research team. So you shouldn't have, you know, an academic who's, you know, receiving an amount that's double or even any more than the people with lived experience. And we certainly don't want teams who are paying people with lived experience in, you know, kind of honorarium or gift cards or things like that, because I think oftentimes lived experience folks are tokenized in research teams. So really what we're getting at here is, you know, that people would be paid on par with one another. So really establishing equality across team members.
Thanks, Lynette. Do Joanna, Rich, Donna, or Roberta, do you have anything to add there?
Yes, this is Joanna. I think generally resources need to be shared, and this is the budget question and the question for fairness. So as Lynette suggested, there will be different people involved in research activities. Some are already paid by their salaries, some don't have access to resources. And I think this is the steering committee, which will be drafted by different groups of people, should really debate, you know, the fairness of sharing resources within the budget with groups who will be involved in the research process.
Okay, thank you. Donna or Roberta, do you have anything to add there?
No, nothing to add.
Okay, thank you. Just give me a moment. I'm taking stock of the next question here. Okay, I'll just ask the team supporting me. I've answered the question you're asking me to answer already. Is there another question I can go to? I understand now we're being asked to repeat an answer to the question because somebody had their audio coming in and out. So regarding team composition, If the target of the project is informing care providers, are care providers classified as individuals with lived living experience? So if half the team is composed of care providers from the target population, does this address the composition criteria? So when we discussed this question before, if I'm remembering correctly, the answer was that the important piece is to ensure that the team composition reflects the priority populations that are outlined in the RFP. Service providers writ large were not included as a priority population. However, if the service provider community is one that reflects the characteristics of the populations that are being targeted through this research initiative, then yes. Thank you. So who can hold the funds? Does it have to be an academic institution? Who is eligible to apply for funds? So again, I believe we've addressed this question more or less already. An individual is one that where is the only circumstance where we would potentially be challenged to transfer funds. It does not need to be an academic institution. Often that is the case for, say, something that's funded through the Canadian Institute for Health Research, but in our case, we have more flexibility and can enter into a funding agreement with various kinds of organizations, whether it's Indigenous government or a community-based organization. We should be able to find a way. Okay, thanks very much, everybody. My understanding is that we have completed the questions that have come in. We certainly encourage you to contact us via email at the cannabis@mentalhealthcommission.ca address that was provided on the slide. If you're looking for more information regarding a question, or if you would like to be contacted with the hub, we really would like to hear from you. We're very excited to see what kinds of proposals and projects come forward, and to seeing some of your good work and good ideas be supported over the coming years. So thank you very much, everyone, and please be in touch.